So bud cherries are usually very sick. So this will be an exception to that rule. Remember that.
So it could be a chronic bud cherry where he is not very sick. Okay, so we'll keep in mind post-sinusoidal portal hypertension.
What else can it be? He may have gone to other doctors before that.
Well, suppose this child has a half smiling umbilicus. He's not smiling like this.
Like K.N. Singh. Okay, which type of love? No.
Ovarian cyst.
Mesenteric cyst.
Why? Because he's not sick and not a so all other illnesses will have him going down. What else can it be? Fellow has been taking some white colored tablet. First he had swelling. Yeah. So if he's a nephrotic who's recovering, his edema may go, but there will still a side effect.
And in which case he would have some telltale signs of steroid. So it will be full cheeks, okay, and still ascites. So recovering nephrotic or a mesenteric cyst, whatever. Yeah. Good.
Okay. So we use this as a prototype to analyze abdominal distension only on observation. Let's go on. This is a fourth.
Mesenteric cyst in 4 years would have a long-standing history.
Mesenteric cyst is just
like no, he is not sick, he is grown well. We are observing. Okay.
He will come to you with abdominal distension and
he could come with abdominal distension.
See Ketan, this is a one-time observation, so we don't know the duration.
Yeah.
But mesenteric cyst is a mechanical problem, so it will not affect the growth or it will not affect anything. It will not give you a clue that it's a long-standing problem.
The story will be abdominal distension for which everyone has been breaking their head and not being able to find it.
And these are actual live cases where a person would tap, not know whether it's exudate, transudate, he will keep on fighting, but he would not take into account that he is a happy, normally growing, asymptomatic ascites. If I put the adjective asymptomatic ascites, you will start thinking almost all this. Right?
Sir, tell us the story of that half-smiling umbilicus.
Half-smiling, my intern picked up. Okay, a child was admitted with a mesenteric cyst. My registrar did all kinds of investigation for ascites, liver function test, this, that. And intern said, but this is half-smiling. What an observation, no? Because he has learned smiling umbilicus. He said, sir, only one side it is stretched. Oh, it was enough to say, this is not a free fluid, it is flowing all over, it's loculated. Oh, it was a mesenteric cyst.
Facial palsy on one side.
Yeah.
We see facial palsy on one side, no, something like that, yes.
What does that tell you? Chronic long-standing disease. Not acutely sick. So no infection.
Upper abdominal distension.
Hepatomegaly plus or minus splenomegaly. Very good. No jaundice or significant pallor.
Now what?
Hemolytic is ruled out. So liver function is maintained.
There is congestion.
So compensated liver disease.
Compensated. You said liver disease. Sir said or you said? Sir said. Sir, don't leak the paper.
He whispered in my ear.
So, as sir said, rules out a hemolytic anemia, upper abdominal distension, not sick, poor growth, compensated liver disease. वो बाकी biopsy करके decide करना. 2-year-old looks severely pale. So when a child comes to you with severe pallor, what are your thought processes? Very good, acute. When is the child acutely pale?
Hemolytic or hemorrhagic? Hemorrhagic or
It
hemorrhagic?
may not be a hematological disease at all, but he's looking pale. So acutely you will rule out shock first. Okay, then? So you're saying lost.
Sick or not sick?
Again you will look for sick or not sick. What does that tell you?
Sick is an acute loss of blood.
Yeah.
Acute loss of blood is a sick.
Would you look at his growth? Why?
A chronic anemia, there will be growth failure.
Which chronic anemias do not have growth failure? Sorry. All chronic. Iron and your B12. They only these being deficient, the child will not show poor growth. So nutritional anemias, pure nutritional anemias, will not have poor growth. Okay. And hemolytic anemias, long-standing diseases will all have poor growth. What else do you want to know? You want to look for sites of bleeding, so you look for petty. Why do you want to look for petty? What?
One cell line is involved.
Excellent. So you know whether it's a marrow involvement, more than one cell line and all that. Okay. Anything else you want to know? When you want to look at the child's face, you want to see something?
Jaundice.
Jaundice. Okay, very good. What else? That tells you about hemolysis.